2 or 3 years ago?
The Catholic Church is on record as supporting access to health care since 1919.
Agreed. Did you support this legislation?
We supported the principle of universal access, but we did not support the bill and all of its particulars.
Reverend?
It's our religious policy, believing there's a strict separation between the two kingdoms, the religious and the governmental, that our church shouldn't be spouting off on every government issue. So we took no official position on. You guys do a great job of that.
Okay.
Yes.
Dr. Mitchell?
No, as Baptists, we don't take a position as a denomination per se, but no one either has recommended or commended the policy.
Rabbi?
Religious people on both sides of the aisle can agree or disagree on larger questions of health care, but both should be extremely distressed when the religious freedoms of anyone in America is threatened.
Dr. Mitchell?
As the previous Dr. Mitchell said, the Southern Baptists don't take official positions on this, but
okay.
We weren't for it.
My time's running out. I've got two quickies. Rabbi, why do you think the President, give me a 20-second answer, is pursuing this so vigorously?
I asked the same question, and I just don't understand why he is seemingly so, in this situation, the President and the administration just do not seem sensitive to the religious concerns.
Okay, and let me, just as my time runs out, let me quickly rephrase a question my good friend from South Carolina asked. At the end of the day, if it comes down to listening to your God and or listening to your government, where are you going to fall? Bishop?
Thomas Jefferson, I've got his Bible from the Smithsonian, the famous Bible he cut all the pieces. And I would have something to say against some of the bits he took out, but he did leave in Matthew 22, they say unto him, Caesar's. Then saith he unto them, Render therefore unto Caesar the things which are Caesar's, and unto God the things that are God's.
Is it safe to assume that that's where all of you would fall?
Yes, and I would add, Congressman, since you mentioned the Virginia Statute of Religious Freedom, of which Jefferson was rightly so proud, and to which Jews and all Americans have a great debt to him for that. I don't remember the exact text, but after establishing religious freedom, the actual bill that he composed concludes by saying something like, and if any other legislature does seek to limit this freedom, we are hereby stating that they do so in contravention of natural right.
I thank the gentleman. If I could ask our panel, would you remain for just 10 short additional minutes for the last two witnesses two congressmen that we had by unanimous consent? With that, the gentlelady from Connecticut is recognized for 5 minutes.
I thank you very much, Mr. Chairman, and also the ranking member. I just want to express my view on the new guidelines. I think that in releasing national guidelines for preventive health coverage, like 28 states before them, it includes contraceptive services, but a whole variety of other services as well. The administration made a strong and a long overdue stand on behalf of women's health, and at the same time upholding the religious liberty of churches, mosques, synagogues, and related institutions. Last Friday, and even though, as I said earlier, the guidelines exempted churches and other houses of worship, as it should, I believe in that exemption, the President provided more flexibility to charities, to hospitals, and to other kinds of religious organizations. Hospitals are not just providers, but employers. As providers, nothing has changed. They do not have to prescribe, dispense, provide for any contraceptive services. As an employer, there are kinds of employer regulations on the books that faith-based institutions are bound to respect. Suppose someone decided not to pay the minimum wage. Would we accept that? Now, just further, one note is that the constitutional issue, constitutional expert David Boies, who was appeared on TV last week, said there isn't really a constitutional issue involved in this issue. First Amendment of the Constitution prohibits establishment of religion, meaning that you can't have the government saying that you have to follow certain religious beliefs, and guarantees free exercise. That means everyone is free to exercise the religion they choose. There is nothing in the Constitution that says that an employer, regardless of whether you are a church employer or not, isn't subject to the same rules as every other employer. I have a particular question that I would like to ask, and this is about actually contraception as a medical treatment. As I was preparing for the hearing today, I was contacted by people who wanted the committee and the public to understand that contraceptives are often used to treat potentially life-threatening diseases. Let me just give you a couple of examples. We heard an account from a woman in Kentucky, and she said, "Birth control for me isn't about preventing conception. I have to take the pill because endometriosis runs in my family. When I was 5, I watched my mother suffer a massive hemorrhage because of the disease. My doctor put me on the pill to stave off the disease. To me, birth control means preserving my fertility and my life." This woman may not be able to have children later if she does not take this pill for medical reasons. It's medical reasons. We heard from a number of doctors. One account from a doctor in Chicago. My patient is 45 years old. She has 4 children. She suffered a stroke 2 years ago. To prevent future strokes, she needs to take a blood thinner. Her condition is complicated because she experiences heavy bleeding, and IUD is the safest option to reduce that bleeding. Her husband works as a facilities engineer at a large Catholic hospital. His insurance will not cover contraception for any reasons. An employer's refusal to cover this necessary medication creates a hardship for her. It's about $1,000 in the cost for that medical device. I'm going to give you a personal example. I am a survivor of ovarian cancer. This March, 25 years. There are so many studies. I'm not a doctor. I'm not a scientist. But there are medical studies today that show, and we can give you all the citations, that women who do take the pill have a much lower risk of developing ovarian cancer. After 1 year of use, 10 to 12% lower. After 5 years of use, 50% lower. Over 15,000 American women died because of ovarian cancer just last year. I am alive because of the grace of God and because of biomedical research. And I have to ask each of you, are you morally opposed to allowing women who work in your facilities, many of whom are non-religious, whatever the denomination, they were not hired for a religious purpose. Are you opposed to allowing them to take a pill or to get an IUD in cases where their lives dependent on it? And when we know that it could lower the risk of ovarian cancer.
The gentlelady's time has expired, but
it's about 25 seconds according to my clock here.
Actually, you're 29 over.
Oh,
Madam.
I'm sorry.
No problem. But you may answer her question.
I'd just like to respond that our health plan will, in fact, cover contraceptives used for such health reasons. And let me also say, Martin Luther said one time, "Doctrine is heaven, life is earth." I was an inner city pastor for quite a while. Spent a lot of time in slums all over the world. And these ears of this pastor have heard every possible situation of malady of life you could ever imagine. We have principles that guide us as Lutherans. We know that those principles meet real life, and the real lives of people are hurting. And we accommodate wherever we can. We are not rigid kooks. We care about people, and that's our business.
And this rule accommodates women's health services, as well as religious liberty.
Thank the gentlelady. Anyone else that wants to just answer a question briefly? Bishop?
Sure. Let me just say that people who come to work for us, whether it's the diocese or Catholic Charities or a university, they're coming to be part of a mission. These things are not side businesses. They're part of our mission. And secondly, our Catholic moral theology, as I've indicated, recognizes that the same drug can be used for different purposes with different effects, and our plans reflect that. So we should be given credit for the nuance and the understanding that we have already brought to the table. All the more reason for the government not to move in and try to force our hand now.
So it's basically true to the lady's question. All of you, to the extent that you're involved in health care, would provide health care for the reasons that did not go directly against your faith, such as the bishop said. Yeah.
As this rule does, is not goes against anyone's faith.
Thank the gentleman.
Provides an accommodation.
We now go to the gentleman from South Carolina for 5 minutes.
And I thank the chairman and the ranking member and the other members of the committee for the opportunity. I'm not a member of this committee, and I do value this chance to ask very briefly, follow up on the question that I was speaking on a few minutes ago, which deals not with the impact of this bill, not necessarily just the exemption, but the bill on men and women of religious conviction who own and operate businesses and have employees. And I encourage to you gentlemen, each of you, to consider that, and to, when you leave here today, to contemplate that as well, because that infringement of religious freedoms existed before the current discussion about the HHS rule, and even assuming a satisfactory resolution of religious exemptions for religious organizations will exist after that resolution. Men and women of religious conviction were put in this position at the very initial passing of this law, and even if religious organizations are ultimately exempted in a way that you gentlemen would find acceptable, I would put it to you that members of your congregations will still be similarly situated and still be put in the same condition. That being said, and finally, I have a request specifically directed to Your Excellency, Bishop Lori, but also to the rest of you gentlemen as well. There were various organizations that I thought were very accurately described today by colleagues on the other side as having supported bits and pieces or all in part of this legislation when it was originally debated several years ago. And I would encourage each of you to consider the possibility that using a secular federal government to help advance religious principles, regardless of how admirable they might be. I'm familiar with the Catholic social justice teaching and doctrine, but to use the federal government to accomplish those things may, in both the short run, as we are learning today, and in the long run, be unwise. And to paraphrase many politicians, many great thinkers from the beginning of this country up to recent times, I would suggest to you gentlemen all that the federal government that is big enough to give to you all of the social justice that you pursue is also big enough to take from you all of the religious freedoms that you have. And with that, I yield back, and I thank the chairman for his time.
Would the gentleman yield?
Happily.
As we come to a close, I don't want to extend the time any further.